This should be carried out in any practice, regardless it being private or national health. It literally takes 60 seconds to do, and it could save someone's life. At the clinic, we offer a wide range of services, from routine examinations to hygiene appointments to more complex smile makeovers and implant treatments.
Good morning, Dental at MediaCity. Victoria speaking, how can I help?
Hi Graham. How you doing? I'm good. I'll take that from you. Every patient who comes in our clinic on a routine examination or a new patient examination will get an oral cancer screening. This is first done initially by visual assessment, and then we use a special piece of kit which then highlights any suspicious areas for us to then take further action on. Graham, we're just going to start off with your regular oral cancer screening today, so we're just going to feel around the outside of your mouth and then move inwards and check all your soft tissues. Nothing to worry about, just a routine check, okay? So if you could just bite together for me, and I'm just going to feel around the base of your neck. What will happen there is I will feel around the patient's neck for any lumps and bumps, and then we'll check the jaw joint and then the lips around the mouth. We then move into the mouth and check all the soft tissues to make sure they're healthy, there's no ulceration or any red or white patches which look suspicious. Hard palate's healthy, just say ah. Soft palate's healthy. All cancer screening is really important, especially in those high risk groups such as smokers or tobacco users and high alcohol consumers. Early detection is absolutely vital. 90% of cases can be fully cured if detected early. Excellent. I'm just going to repeat that again, Graham, but I'm just going to use these special glasses just to recheck all the surfaces, okay?
No problem.
So, if you can just open again for me. The goggles have a clever piece of technology which has been developed recently, and what it does when you shine a certain type of light on it, it will highlight any areas which is considered precancerous. Without the goggles, it's very hard to see. Brilliant. Can you stick your tongue out for me, please? The procedure is very quick and painless. It takes less than a minute to do, and it's done on every routine examination that we do at the clinic. That's brilliant, Graham. Everything looks clear. Well done, and we'll see you again in 6 months' time.
Early detection is fundamentally important to us finding these cancers early. It's in the name. If we find these cancers early, we can treat them, and the survival rate is increased immensely. Visits to the dentist is important. That dentist is so important in finding these cancers in the mouth, and these dentists are trained to do that. If we can find these cancers early, we can treat them, and hopefully survival rates will increase.
I think this oral check is a great start to the procedure. The dentist goes around the left and right side of your gums and just asks you a few questions. It's more and more important now for this to be carried out, and there's a great opportunity for that to happen while you're at a dentist. It's painless. I think it's very important. It takes less than a minute.
It's vital that if you have any lumps, bumps, sores or ulcers in your mouth, or even a cough that lasts more than 2 to 3 weeks, that you go and see a dentist or you go to a health professional like your doctor and get that looked at further.